So let me just perhaps mention that perhaps you've seen the information, but we'll have a third session of this seminar. So the first has been given by Rémi about how the epidemiologists do evaluate the risk of climate change for health. This second today will assess the question of co-benefits of mitigation and adaptation action for human health. And then the third seminar, I don't have the date in mind, but you may have received the 7th? The 6th of November. Thank you, Helen. So we'll focus on interventions to change behaviors toward more climate-friendly and healthy-friendly diets. That will be given by an environmental and nutritional psychologist from Dijon, from INRAE, Lucille Marty, who is conducting very nice, interesting research on intervention. The rationale is once we identify that diets or other kind of behavior do have impact on climate and that changing it may have huge co-benefits for health, how do we do to go there to have people and societies adopting more climate-friendly and healthy regimes. So that will be the third part of this seminar. And this is also something that we could discuss. So you know that after this seminar, we'll have some sandwiches to share together. So the seminar will last for 40 minutes. We'll have time for questions, like kind of formal Q&A. And then if you want, we have free sandwiches. So feel free to stay and just discuss a bit more informally. And one of the questions we may be interested is there other topics? For now, we scheduled only 3 sessions of this seminar. Would you be interested to other sessions or thematics for further sessions linking climate change, geosciences, and human health? So perhaps we can start. What do you think, Hélène? Yeah? Okay. So thank you so much for coming here. Very happy to be here for this second session of this seminar on the links between climate change and health. I'm Kevin Jean from the Department of Biology. I'm an epidemiologist, a junior professor in health and global change. And today I will discuss and present a bit how do epidemiologists assess the co-benefits for human health of climate change, mitigation and adaptation policies. So last month, Rémi Slama, my colleague, introduced this seminar on the methods that epidemiologists use to assess the impact of climate change on health. He mentioned the way to construct this dose-response relationship between temperature and mortality. And he mentioned a bit, and that's the idea, how we can project then, according to future climatic projections, the impact of climate change on health. So the idea is that based on empirical data, you can measure the relationships between temperature and health. And then the idea is to model exposure, model future exposure according to various climate warming scenarios. And linking these two kinds of informations, you can estimate the Earth's impact of future temperature trends on human health. So you have future temperature. Sometimes you have to extrapolate above the range of variation that has been observed in the past for these relationships. You know that there is a distribution of temperature will shift due to climate change, and you can estimate the shift in mortality by applying those response relationship, this one, to this projected distribution of temperature. This is basically the method of the Earth impact assessment, which relies on the fact to use dose response relationship on projected or modeled exposure to assess the impact of actually any scenario. And this method has been widely used to measure the risk, some risk assessed for climate change. Rémi already mentioned that last month. So we have now a growing research field linking climate change and health. This is the number of publications by year that is tracked by the Lancet Countdown. And you can see that the number of publications, scientific publications linking climate change and health is increasing over the past years. The interesting thing is to look a bit more in the detail of this publication, and you see that mostly 80% of these publications have done what I just described, means assessing the present or future risk of climate change for human health. So this is important for preparedness issue, for anticipation, but perhaps this is also important to look a bit more into these two colors, which represent the studies that are focused on the link between climate change adaptation, the pink one, and mitigation, the red one, and human health. And what is that important? Because eventually I think that we could agree that we are interested here to produce research that may trigger public action, that may trigger political action to tackle climate change. And well, for now, just documenting the risk has not worked so well. There has been 6 reports from the IPCC documenting more and more precisely the risk, and this has not been sufficient to trigger climate action. So perhaps the idea would be to look whether we could focus a bit more, so we can understand why documenting the risk is not perhaps just like self-standing sufficient to trigger climate action. Communication science have studied this question, and we know that when we project like the research that is mainly in the media is the research that has been largely focused on future risk, and when we talk about future risk, we talk about 2050, 2100, or risk that is perceived like far away in geography, like the most at-risk region are perhaps the tropical region. So we know that there is this kind of distanciation effect, distanciation in time. We feel that the risk is not for today, the risk is for tomorrow, and like in the future that we will do that later. Or distanciation in geography, in like the geographical scale, the risk is not for us here, but perhaps other regions are most at risk. And that's why I like the fact that just focusing on the risk is perhaps not like the only way to hope triggering action, and that is an invitation to give a bit more effort toward these mitigation. There's links between climate change, adaptation, mitigation, and human health. And this is also something that has been already identified by the IPCC. We will talk about co-benefits, the fact that there is climate policy could generate co-benefits for human health and in other fields, social inequalities, biodiversity. And actually we know that these co-benefits is a good lever for action. This is once again mentioned in the IPCC report. And we can easily understand why, because it offers a new perspective on the climate issue. Why? Because to solve the climate crisis, roughly, we know what to do. We need to phase out fossil fuel burning. So in France, for example, where transportation is the first sector of emission, of greenhouse gas emission, it means that we must prioritize less polluting transportation. Another major sector of emission in France or in developed country is agriculture, and especially meat production with the methane that is produced. So we know that we need to reduce meat consumption in the diet. If we implement these policies, like we reduce by something like 75–80% the emission of greenhouse gas effect. But we know that this is not so easy, because this represents efforts to do now for benefits like climate benefits that may be realized in the long term, and that as human beings we are more prone to focus on the present, and doing effort now for future rewards is something that we are not very prone to be. And we know also like that this framing is also something has also something linked to a mismatch of scales or perception, because we need to do efforts, but the population that does the efforts do share all the benefits with all the population in the world, because CO2 has no borders. So these benefits are diluted between population that do the efforts and population that do not. And this is also something that may trigger this well-known freerider effect. Like, let's say that the best strategy is to wait from the other to move first, and we will benefit from like the mitigation efforts. So we understand, and this is some of the explication, at least partial explication, why climate efforts is not something that you may want to approach if you're a politician. It doesn't look very popular or very rewarding. But the thing is that we could look at the very same actions, but this time with the public health perspectives. And here what's interesting is that there is a huge and massive convergence between climate and health objectives within these policies. For example, we talked about reduce fossil fuel burning in the energy mix. This is also one of the best ways to improve air quality. And air quality, for example, in Europe is responsible for more than 250,000 deaths a year. So one of the major determinants of health. We mentioned prioritizing less polluting transportation, such as public transport or active transportation, cycling and walking. This is also a very nice way to increase physical activity, even public transportation, because you always need to walk to your bus station or your train station. And increasing physical activity is actually an important topic in public health, because we know that in Europe, nearly 30% of adults are lacking of physical activity, and this may be responsible of about 10% of all deaths. And last but not least, reducing meat consumption is also something that we would be rewarded to do for nutritional perspective, because like classical European consumers consume 2 to 3 times more meat than the recommended levels. So we have here a very nice convergence between public health objectives and climate objective. But the thing that the public health perspective may offer is this kind of a bit more appealing approach. Why? Because here we are talking about short-term benefits. You don't have to wait decades or centuries to see the health benefits of these policies to be realized. We are talking about timescales that are about months or years, but not decades or centuries. Sometimes days. Physical activity, you have like public health effects on the scale of some days. And the other thing that may change a bit the framing of the problem is this kind of cost-benefits perception, because here we are talking about changes, efforts, but these efforts will produce their benefits for the population that makes the efforts. So you don't have this dilution issue. These efforts are not conditioned to the global action. We know that to solve climate change, we need to reduce globally greenhouse gas effects. And if a country like France by itself reduces greenhouse gas emission, but other countries do not, that will make few difference. But here it is not true for public health. If France implements these politics alone, like perhaps it will not be cooler in France than elsewhere in the world, but at least the French population will be healthier and fitter. And once again, these benefits are perceived by the population and the individual that consent to the effort. So you see that the public health perspective somehow offers another way to frame these climate policies, and this other way kind of resolves these scales problem we had between temporal scales, because here we are talking about short-term health effects and long-term or medium-term climate effects, and local health effects and global climate effects. So you see that this offers a best match to today's scaling effect. So that being said, now how do epidemiologists to estimate these co-benefits of climate action? I mentioned the weight of each of these determinants of health. How do we do to estimate the co-benefits of climate policies? The method that we're using is the one that I mentioned. This is called Health Impact Assessment, Évaluation quantitative d'impact sanitaire in French. And this is, for example, the method that Santé Publique France or other agencies regularly use, for example, to estimate the burden of air pollution in France or elsewhere. The idea is to look at one association that you think could be causal between one determinant of health and an health outcome. That could be, for example, what I mentioned, the association between temperature and mortality. I mentioned air pollution and mortality. These are kinds of relations that you can study using this method. You could also look at the relationship between diet and health, or physical activity and health. So you start looking at this association, and then you go back to the literature to look at toxicological or epidemiological evidence for those response relationship between these factors and health. We'll mention some, but well, we'll see what are or how are represented. There is dose-response relationship, but the one I presented on temperature is one of days. And then the idea would be to model the future or projected exposure of the population under different scenarios, and then to apply this dose-response relationship to these projected scenarios of exposure, like I mentioned for air temperature. And this allows to compare some scenarios, for example, like scenarios like wish scenarios, like what if we manage to reduce air pollution by toward like the recommendation level by WHO, and this is something that you and you could use several models like then to model future exposure that we'll see, and this allows to estimate, quantitatively estimate some impacts on health of policies on interventions that may not directly be focusing on health, on the health sector. So we'll give some example of that. One nice input scenario that you could use to apply this method are net zero emission scenarios. So I guess you've all heard about what are these net zero emission scenarios. That are scenarios that are produced by various actors. That could be national agency, like in France, for example, ADEME, l'Agence de la transition écologique, develops these scenarios. The government has net zero emission scenarios. In France, this is the SNBC, la Scénario National Bas Carbone. These are these national contribution comment on dit au COP? C'est les NDC, National Determinant Contributions, which are these net zero emission scenarios done by governments that have been negotiated at the COP. And these scenarios do describe combination of changes in economic systems that are compatible with a trajectory going to net zero emission by 2050 or other temporal scales. What is interesting in these scenarios is that they give precise description of various sectors of activity. For example, here you have the projected evolution of the sector of energy under the negawatt scenario, and this gives you the change that are expected to reach the condition of net zero emission scenarios. And based on these scenarios, as an epidemiologist or with the tools that you or other colleagues develop, you can project and model some exposure that is important for health. For example, based on these changes in fossil fuel consumption, you can model the future scenarios of air pollution. So you can, these changes in some sectors do imply some changes either in the environment, air pollution here, or in lifestyle. We'll see some examples that may affect us and that we can actually model. We have tools to model these changes. So here, this is a way to model future exposure. This is one part, and the other part, as I mentioned, is to use dose-response relationship that we find in the literature. For example, this one is the dose-response relationship for mortality, linking mortality and concentration of ambient air in PM2.5, or particulate matter. And so you see that the risk of death increases by 15% nearly for each increase of 10 micrograms per cubic meter. So combining these future projections of exposure and dose-response relationship, and you can also use future demographic projection to account for aging of the population in the future. You can assess here, for example, the health impact of changes in air pollution exposure within a scenario of net zero emission. Is that okay? This is an example for air pollution. You could do actually exactly the same for physical activity. Here, for example, still in the negawatt scenario, this is the projected changes in modal share of transportation. So these are, I know you see nothing here, but these are kilometer passenger by cars, the big color, or cycling and walking, so active transportation, and the changes like here is 2020, 2035, 2050. So the scenario do explicit the projections that are needed to reach this objective of carbon neutrality in the transportation sector. And here you can model changes in exposure. Here this is changes in exposure in a lifestyle factor, physical activity. that is relevant for health. And here what you can do is just use this global, like national level of cycling and walking, distribute that over ages under various assumptions that you may explicit, and this gives you the projection of increases in physical activity under the scenario of net zero emission. Here we also have very nice and very robust dose-response relationship linking cycling and all-cause mortality. Each time, like for each increase of 100 minutes per week, means 1 hour and 40 minutes per week of cycling, the risk of mortality decreases by 10%, and this accounts for all other factors. So this is a very impressive dose-response relationship. I don't know many things that you can do to so quickly reduce your risk of mortality. And so combining these two information, you can here assess the health impact of cycling within the scenario of reaching net zero emissions. Is that okay for the framing? So let's go a bit into the detail with this example of cycling, which is perhaps the most simple, for you to see a bit more what does that imply in terms of methods. So the objective here is, like the method that we are using is a comparative risk assessment, because we are comparing two scenarios. One baseline scenarios, for example, where we assume that cycling levels do not change over time, and one in which we assume that cycling level do change according to the projections of net zero emission scenarios. So we have a reference case, like today, the level of today, and a comparison scenario, and we know that we have a dose-response relationship. So by increasing physical activity or active travel here, you decrease the risk of mortality. The data that you need to conduct these estimates is first the baseline level of the health event that you're looking. So if you're willing to assess the impact of cycling in terms of death prevented, of mortality avoided, you need to have number of deaths that are projected in the near future. So usually demographic departments do give that. We have nice projections of mortality by the INSEE up to 2100 or 2050. So this is something we have. But you can also look at number, for example, of cases of diseases in the population. This is also possible, like, to look at other events than just mortality. But well, mortality is a nice example because usually National Statistics Institute do provide these projections of number of deaths expected for each year. Then you need to have a level of exposure for each of the scenario you are comparing. So for the baseline scenario, you may look at, once again, INSEE data, demographic data. There are studies that are assessing by how much people do cycle in France, and this is your baseline level of cycling and walking. And you can use, as I mentioned, future projections to make assumptions of the future levels of cycling and walking under these net zero emission conditions. So that's it. And then you need to have this dose-response function, dose-response relationship, linking the health event that you're interested in, mortality in our case, and exposure, so physical activity in our case. So as I mentioned, for cycling, we have a very robust dose-response function that has been detailed in 6 or 7 very different cohorts of population. So we know that when we look at population, we look at people over time. We do account for socioeconomic factors, for tobacco, for alcohol, for other activity, for other physical activity. We see that all other things being equals, people who do cycle do have a reduced risk of mortality. The dose-response relationship is this one. So as I mentioned, 10% of decrease in the risk, so this is a relative risk of 0.9, 90%, so reduction of the risk for 1 hour and 40 minutes. Why 1 hour and 40 minutes? Because it corresponds to the level recommended by the World Health Organization for physical activity. So here the thing is that we have a relationship that is this one, and well, actually you could assume both a log linear or a linear dose response function, which is useful then to interpolate the level of physical activity. Both log linear and linear dose response function are quite okay, and they do not change so much in the case. So we are all what we need, but here, as I mentioned, we have this dose response function that is given for 1 hour and 40 minutes. We have exposure of the population, so we make the assumption, for example, that in France, in 2030, the population will not cycle 1 hour and 40 minutes, but perhaps just 1 hour or 50 minutes. So how do? We have formulas to translate this increase in walking based on this dose-response relationship, to somehow scale this dose-response relationship to find the reduction in the risk that we're looking at that correspond to the level of exposure we assume. This is very basic. This is very basic mathematics. So here we have a reference that is the 0.90 that is given for 100 minutes. If we assume that people are not cycling under 100 minutes but 50 minutes, you can apply either a linear dose response function or log linear, but you see that the changes is very minimal in these two cases, meaning that if you cycle not 1 hour and 40 minutes but 50 minutes, you will have a decreased risk of mortality by 5%. So this is the risk of mortality that you estimate in your scenario while you projected level of cycling of 50 minutes. And then what you will do is just to compare the level of mortality expected in your reference cases based on the observed level of mortality. And then you do the same in the comparison cases. So here when you assume that people will cycle 50 minutes a week, and then you just have to make the difference between both. The difference between both do give you the number of deaths that you expect to be prevented if people were cycling 50 minutes per week. So this is like a rule of 3, a bit more refined than that. You can refine that a lot. What is important, for example, to refine that is to account for other factors for heterogeneity in exposure or in the baseline risk mortality, namely. Why mortality? Because your risk of dying, the risk of mortality do change a lot by age. We know that older people tend to die more than younger people. By gender and by all other factors you think are relevant to account for in this analysis. And what is very important is this exercise of Earth impact assessment is to conduct a large range of uncertainty analysis. There are many uncertainties arising. Most of these, or one of the most important source of uncertainty are these dose-response relationship that usually carry a high level of uncertainty. And so this is important to change these assumptions to make it very transparent, to have a best idea to the factors that do determine a lot of your results. Is it okay? Okay, good. So let's do that example. So I mentioned that under the negawatt scenario, you can make these projections of level of cycling in the general population. And then for each level and each age group, you can look at the baseline risk, so the mortality risk for this specific age group, and by how much this risk is reduced by the assumption you made on the level of cycling once you scaled your dose-response relationship. So this is the graph I already mentioned. So let's do that example for one French net zero emission scenario, the one developed by the association Negawatt. So you may know about the vision of net zero emission in this Negawatt scenario. Negawatt is an association that make the scenarios with 3 levels. The first is sufficiency. So Negawatt make a big focus on changes behavior, collective behaviors towards sufficiency. The second level is efficiency. The third is renewable energy. And in the negawatt scenario, once you look at per capita level of cycling over years, the evolution, you see that the negawatt scenario assumes that cycling do increase by a factor 7 between 2020 and 2050. Okay, so this is the assumed increase in cycling if we want the transportation sector to be decarbonized, among other transformations. But this is the one we are looking at if we want to look at the benefits of physical activity. For walking, the increase is a bit lower, but the thing is that the baseline level of cycling are already high in France, so we have not the potential of increase that we have for cycling. We cycle very few in France, or that was the case in 2020. This looks like very huge as a step for increase, but here in 2050 the levels are still under those that are observed now in Netherlands and Denmark. So that does not look very crazy to project these augmentations of cycling. And when you apply the method that I mentioned, you can project that this increase of physical activity due to walking and cycling do translate into more than 10,000 deaths prevented each year by 2040. In terms of gains of life expectancy that you can calculate from this method, it translates to something like 3 months of gain in life expectancy for the whole population. As a comparison, during the COVID crisis, at the harder period of the COVID crisis, we lost something about 6 months of life expectancy in France. And when you translate that, and economists do have methods to translate death or health into economic costs, so valuation tools, this translates to more than 35 billion euro of intangible health costs prevented. So this is how you can imply this health impact assessment for physical activity linked to transportation in the negawatt scenario. As I mentioned, the negawatt scenario is a very has its own vision of net zero emission that relies a lot on sufficiency. You can do the same looking at contrasting scenarios of carbon neutrality that rely on very different assumptions. You may have heard about the scenarios developed by the ADEME, which developed not 1 but 4 different waves, so scenarios targeting net zero emission, scenarios that do a lot of emphasis on sufficiency, others that do more emphasis on technology and that where the behavior do not change so much. The interesting thing is that the health, like the projection of walking and cycling are very different within these scenarios, but the health impact of increased physical activity do changes a lot within these contrasting scenarios, which is interesting because in terms of climate, these scenarios are somehow equivalent, say. Well, there is much criticism that we can do on some of these, but they are somehow equivalent because they have been developed to be so, to reach carbon neutrality. And what we see is that they are not so equivalent when we talk about public health and not just climate issues. Okay, so this was a focus on the transportation sector, and this method you can apply it to a multi-sectoral approach, look at other sectors of activity and the changes in these sectors that carbon neutrality may yield. So I mentioned the energy sectors, and this is the work that Ayushi Sharma, postdoc in our team, is conducting. So the chain of modeling that Ayushi is developing is still relying on the scenario, net zero emission scenario developed by ADEME. But here we have the CDEPA that you may know, that is the organism looking at making the inventory of emissions of greenhouse gas emission, but also pollutant emission. The CDEPA did translate these scenarios into evolution of air pollutant emissions. So the CDEPA gives us projections of national evolution of pollutants, and here by using air quality or air transportation models like Sherpa, which is a surrogate model, an approximation of the Séminaire model that you may know, we can estimate the concentration of pollutants, here for example PM2.5 in the future under these scenarios. And then we can develop the same kind of health impact assessment. So in the preliminary results from Ayushi, what we are observing is that all these scenarios, as compared to a scenario where the level of air pollution remained stable at the 2020 level, each of these scenarios do translate into a number of deaths prevented, about 20,000 deaths a year. as of 2030 and 2050, it translates into 4,000 deaths prevented a year due to the reduced air pollution that we expect within net zero emission scenarios. That makes sense because in this scenario you stop burning fossil fuels, and this is a major contribution of air pollution. But what is interesting here is that these 4 scenarios are much more equivalent in terms of health impact than we've seen with transportation. When you look a bit in the detail, you see that they are equivalent for different reasons. For example, the 2 first scenarios do prevent more death in the transportation sector by assuming larger reduction of emissions of air pollutants in the transportation sector, while they assume they project less deaths prevented in the residential sector. So the sectoral contribution is a bit different, but what is important also is to recognize the huge uncertainty we have in these estimates. Once again, health impact assessment methods are more done to provide order of magnitudes rather than precise results. So this is the work done by Ayushi Sharma. And last, in the same team, we are developing the same models to translate nowadays net zero emission scenarios into changes in diets. So here we have, these scenarios do explicit changes in the agricultural sector to reach net zero emission, and this could be translated into changes in the food we eat, in the diet, and we can make this change. What changes here is that we have many dose-response relationship, one by each main food group. And so this is the work done by Ines Mazurel in her PhD. So here we rely on work that has been done by INRAE mostly and other colleagues that did translate these scenarios to changes in diet. For example, you see that in each scenario, you start by a consumption of 160 grams of meat a day, and that this should to decrease by a large amount in S1 scenario. Like you should go to 40 grams a day, and less, but still a decrease in the S4 scenario. Here, the thing that changes is that we don't have just one dose-response relationship, but in the literature we find 13 different dose-response relationships that link consumptions of some kinds of aliments and the risk of mortality. And here, the results that that are preliminary and that Ines is producing at the moment shows that here we are rather talking of number of deaths prevented that could reach up to 100,000 deaths prevented a year as of 2050 under the scenarios, with some variation in the scenarios, but like the amount of deaths prevented is very impressive. This makes sense because we know that poor diet is responsible for about 20% of all deaths in France. So these huge potential contribution of diet change could be very important. So this is for 3 sectors of activity, as I mentioned: air pollution, active transportation, food. We start also to develop some similar methods, this time to assess the co-benefits from adaptation policies, not just mitigation. And here, the one that we're interested in is urban green space. So this is interesting because in the literature, we have, once again, this dose-response relationship linking the fact to live nearby green space and the risk of mortality. So if you live nearby green spaces, urban green spaces, all other things being equal, your risk of dying is lower. And one way to measure greenness is the NDVI, that is a remote sensing indicator that you may know, that do capture photosynthesis. And we find in meta-analysis a link between this NDVI and all-cause mortality. So NDVI is a proxy of greenness, and this is linked with mortality. And based on it, so if you have the NDVI values from Paris, based on it, in the PhD of Léo Moutet, we developed several scenarios where we try to increase urban green spaces by replacing space that is now taken by cars. So you can replace some parking places, you can replace some roads, you can replace or reach the level of greenness that is achieved in the most green areas in Paris. And by doing this scenario, we can model the expected increase in NDVI, and then model the expected decrease in mortality. This is what we've done doing, and which is interesting here is that we have measures of social deprivation also at this neighborhood level, and we can estimate the number of deaths prevented by this projected increase of greenness, but also look how this death prevented distributes across social subgroups. So here the thing is that we find that we do not correct so much health inequalities, but this is also because actually in Paris, some very rich neighborhoods are very lacking of greenness. If you have all these regions in the center of Paris, they are very not green, like there is very few urban green spaces. So we know that somehow this increases, these scenarios do translate to increase in urban green space for sometimes like rich neighborhood. Well, anyway, the message is that we can translate, we can project the impact of developing urban green spaces on health and look at the distribution of these health impact across social deprivation subgroups. And we all even have that has been developed recently. Yes, Renaud?
Do we have an idea of how the presence of green spaces increases or decreases the risk of mortality?
Yeah, the link between green space and health. Yeah, we have many clues. We know that green space do increase mental health, do decrease the urban island effect, do promote physical activity. If you have urban space, you are more likely to be walking or cycling or whatever, doing your outfits outside. Increase social participation as well. So we don't know the share of each of these contributions, but we know that there's many mechanisms by which it can increase health. And so we can also conduct cost-benefits analysis because there has been some costs of renaturation of urban spaces that have been developed for Paris, for example. So this is one example of how we can assess co-benefits of adaptation solution. So just a few words of conclusion. We are talking about co-benefits of mitigation or adaptation actions. These co-benefits are possibly huge, very huge. In a meta-analysis that we conducted this year, we assessed all the scenarios that rely on net zero emission scenarios in the literature and who modeled health impact from the scenarios. And we've seen that these scenarios do project reduction in all-cause mortality that varies from 1-2% up to 20%, which is massive. I mean, alcohol at the world scale is responsible of 3% of all death. So reducing death by 1.5% is something that is what you could expect from ambitious public health policies. Second point is that in this literature review, when we looked at specifically at studies that compared the costs of reducing greenhouse gas emission and compared it to health gains by evaluating with monetarization methods, evaluating these health gains, what we've seen is that 11 among the 13 studies did estimate that the health gains of this net zero emission scenario did exceed the implementation cost of policies. So in other words, the health co-benefits may exceed the implementation of net zero emission policies on the short term. So which is like you've heard like Le Cour des Comptes in France like last week did publish once again the message that the IPCC is giving saying that inaction will be more costly than action, but actually when you put health into the equation, the gains of action do exceed the costs. Yeah.
So the cost-benefit balance is per sector as well. So you can, and a related question is, so which one is the best bang for your buck?
Yeah. Okay. No, this is based on net zero emission scenario that do target several sectors at the same time. So these are multi-sectoral cost-benefits analysis.
So what's your guess for which one is the one that is better?
Recently, we have been we've had the results of Air Paris about decreasing air pollution. I don't know if you heard that last week. Air Paris estimates that over the past 10 years, air pollution decreased by 50% in Paris. And they estimate that for each euro invested in reducing air pollution, like the Earth's gain was about 10 euros. So the balance like 10 for 1, which is impressive actually. So air pollution is something that is really rewarding. Physical activity as well. In another study, we estimated that each time you cycle 1 kilometer, the Earth's cost prevented is 1 euro. 1 euro prevented by each kilometer cycled. And last but not least, what I mentioned is that different pathways toward net zero emission imply very diverging Earth impact, and that we discuss net zero emission pathways, decarbonation scenarios in the mediatic world. When we discuss that, we are discussing jobs, we are discussing industrial choices. We never talk about health. So health has its own perspective to give within this choice between various ways of decarbonize the society. So I mentioned several ways by which mitigation policies could increase public health. There are several of these ways that I did not talk about, but we have many fields of convergence between climate policies and health policies. I mentioned air quality, physical activity, diet, urban green spaces. We know that decarbonizing the sector of transportation could decrease exposure to noise, which is the second environmental determinant of Earth and costs as much as air pollution in France. Thermal comfort of housing is also a very nice example because if you have an insulated flat, you consume less energy, but also you have less odds to get sick in winter. And these gains are potentially large. So this is the last slide. I've been a bit long, guys. Thank you very much, and thanks to the team. We are working on these results. Many are here.